Social determinants of health are conditions found in the environments where we are born, live, learn, work, play, worship, and age that affect our health and overall quality of life. These include economic stability, healthcare access and quality, neighborhood and physical environment, food and nutrition, education, and socialization and community. It's important for healthcare providers to understand how the social determinants of health impact a patient's ability to receive quality care. When interacting with a patient, take a moment and pause. Put yourself in the patient's position. Advocate for their needs. Understand their unique circumstances and respond with empathy. Suggest alternatives to care and empower patient choice. Pausing to assess each patient's unique situation and being able to recognize the different social determinants of health can help providers ensure the best possible outcomes for patients. Economic stability is being able to afford life's basic necessities, including health-related needs. It consists of a person's financial resources and limitations, such as income and cost of living. A patient's inability to afford medications like anticoagulants can lead to poor adherence and adverse outcomes. Before you write that prescription, pause. Once you understand the patient's economic situation, you can discuss solutions such as financial assistance programs or lower-cost medications. The availability of diverse healthcare options and the quality of care offered, including provider linguistic and cultural competency, all contribute to healthcare access and quality. The location and hours of operations at healthcare centers or pharmacies may limit a patient's treatment options. Language and cultural barriers can also make it difficult for patients to clearly understand their medication requirements or treatment plan. Healthcare providers should pause to actively listen to patient concerns. Provide flexibility when scheduling appointments or lab tests, and determine if the patient could benefit from mail-order prescriptions. If there is a cultural or language barrier, try connecting them with a provider who may better understand their specific needs. Food insecurity occurs when a person has limited or inconsistent access to healthy food options. Having an unhealthy diet contributes to poor health outcomes such as obesity, hypertension, dyslipidemia, and diabetes. These conditions are known risk factors for thrombotic disorders and can compromise the effectiveness of antithrombotic treatments and other medications. When talking to a patient about food and nutrition, pause. Ask about eating habits. Discuss special dietary needs. Determine if they are eligible for meal assistance programs and connect them to a case manager or food bank if needed. Addressing food insecurity is essential to ensuring equitable access to healthy food options and in promoting good nutritional habits. Education level, vocational training, and language or literacy barriers all contribute to education access and quality. It is crucial that providers are able to accurately assess a patient's understanding of their condition, medication needs, and overall treatment plan. Patients with limited literacy or language skills may not fully comprehend the topics being discussed. When educating your patient, pause. Determine their language comprehension, whether they prefer instructions written or verbally, and if they may benefit from an interpreter. Adapting education to match a patient's learning style helps to ensure medication adherence and overall health outcomes. Our neighborhood and physical environment is comprised of where we live, work, and spend our free time. Housing quality, public transportation, crime rates, and access to community or recreational programs all impact our health and well-being. When meeting with a patient, take a moment and pause. Ask about any physical or environmental limitations they may be experiencing. Learn more about their neighborhood and home life, and discuss options for shuttle services or telehealth if needed. Providers should strive to integrate a patient's work and living environments into their care plan. Socialization and community refers to a patient's support system and level of engagement within their social circles, which can consist of family, friends, neighbors, coworkers, and their religious community. Some patients may not have a support system in place to help them manage their health needs. When conducting a patient intake evaluation or creating a care plan, pause. Ask your patients about their support networks, what activities they enjoy, and groups they are a part of. Provide encouragement and support and try to align healthcare plans with your patient's interests. Having ample opportunities for socialization and an investment in the community can give patients a sense of belonging and ensure better health outcomes overall. The social determinants of health collectively affect a person's healthcare experience and quality of life, which is why understanding them is critical to providing the best and most effective treatment and care. In order to do so, remember to take a moment and pause. Taking the time to learn more about each patient's unique situation and how they are impacted by the social determinants of health will help to address health disparities and improve the overall patient experience.